Let's go over the answers to this set of Part 1 questions. First question, an elderly patient fell and struck his head on a coffee table. His family brought him to the ER. He's currently conscious and at his neurological baseline. Non-contrast CT of the head reveals a crescent-shaped radiopacity that follows the contour of the skull, crossing suture lines. What type of intracranial hemorrhage might this be, and which vessels would be involved? So a crescent-shaped radiopacity that crosses suture lines is a buzzword for subdural hematoma. And the most common vessels involved in a subdural hematoma are the bridging veins. Next, where is most of the CSF generated, and what's the function of CSF? So most of the CSF is formed in the choroid plexuses of the two lateral ventricles in the brain. Then the functions of CSF are to suspend the brain, so it's kind of floating in CSF, which prevents forces like gravity from distorting the brain. The CSF bathes the neurons and glial cells in a homeostatic medium so that the body can tightly regulate the pH and electrolyte concentrations and so on. And the CSF also provides a route through which certain chemical messengers can be widely distributed in the nervous system. Next, a child presents with nephritis, deafness, and ocular dysfunction. What's the diagnosis? Well, this is a classic triad of Alport syndrome. The mnemonic for Alport syndrome is can't see, can't pee, and can't hear high C. So be sure you can recognize that presentation. A gene defect in what type of collagen contributes to the dysfunctions associated with this syndrome? Well, Alport syndrome is a defect in type 4 collagen, which makes up the basement membranes or the basal lamina. And what type of collagen organizes bone, skin, and tendons? That's type 1 collagen. And what type of collagen organizes cartilage? That's type 2 collagen. Next, a child is noticed to be yellow by a visiting relative, so he was brought to the clinic. His exam revealed jaundice and splenomegaly. Patient's lab results revealed anemia and spherocytes. So what test is used to confirm the diagnosis of hereditary spherocytosis? Well, hereditary spherocytosis is a condition where there's a defect in one of the red cell cytoskeleton proteins, like spectrin, there's a protein called band3, pallidin, or ankyrin. Now, when these proteins are defective, the red cell won't have its normal disc shape, and it's going to form a spherical shape, which is why we call those cells spherocytes. Now, the classic diagnostic test for hereditary spherocytosis is called the osmotic fragility test, which is where you put the patient's red cells in a series of increasingly hypotonic solutions, and these spherocytes lyse more readily than normal red cells do. Now, there are some newer tests like flow cytometry, which are kind of pushing this osmotic fragility test out of favor, but it's still considered the classic test. Then the next part of the question says, what findings are associated with hereditary spherocytosis? So the red cells are microcytic, and they're round. They have no central pallor. There's increased mean corpuscular hemoglobin and increased RDW. The spleen recognizes these cells as abnormal and then takes them out of circulation, so you're going to have some extravascular hemolysis. And then Coombs test is negative because Coombs test is a test for antibody-mediated hemolysis, and this is not antibody-mediated. Then other features of hereditary spherocytosis include splenomegaly, gallstones, and aplastic crises with stress, such as after a parvovirus B19 infection. Next, what's the composition of a nucleosome? The nucleosome is the basic packaging unit of DNA. It's wound twice around a core of histone proteins. So there are histones H2A, H2B, H3, and H4. And you have 2 of each of these for a total of 8 individual histone proteins in this nucleosome core. And then the DNA wraps around that core. And another important thing to know about histones is that they're designed to bind to negatively charged DNA by having an abundance of the positively charged amino acids, lysine and arginine. So lots of lysine and arginine in the histone proteins. And then which histone ties nucleosomes together? That's histone H1. Next, at what positive G-force does visual blackout occur, and why does this occur? Now, this is a topic that doesn't show up in a lot of Step 1 review books, but it does show up on Step 1 surprisingly frequently. Visual blackout, where a pilot or an astronaut's vision blacks out because of G-forces, occurs at 4 to 6 Gs, because the G-forces are basically pooling blood down in the abdomen and in the legs. There's not enough blood return to the heart and insufficient perfusion of the brain. Next, the dorsal root ganglion is considered gray matter within the spinal cord. From what embryological derivative are the dorsal root ganglia derived? So the dorsal root ganglia are derived from the neural crest, which is derived from ectoderm. Now in Part 2 of the course, we're going to review which parts of the body are derived from endoderm and which parts of derived from mesoderm, which parts are derived from ectoderm. It's very, very important for step one. So it wouldn't be a bad idea for you to start familiarizing yourself with this now while you have a little time. And you're going to especially want to know which ectodermal structures are derived from the neural crest, such as the dorsal root ganglia. Next, a 40-year-old woman treated with lisinopril for stage 1 hypertension becomes pregnant. Why are ACE inhibitors contraindicated in pregnancy? Well, ACE inhibitors like lisinopril and also the angiotensin receptor blockers like losartan are teratogenic. In the first trimester, they can cause cardiac and CNS malformations, and then in the second and third trimester, they can cause renal problems in the fetus. What centrally acting alpha-2 agonist is often used to treat hypertension in pregnancy? That's methyl-dopa. Next, which complement protein is an opsonin? So an opsonin is a molecule that binds to antigen so that it can be phagocytosed and taken out of commission. Now, there are lots of different opsonins, but the two main ones are IgG and C3b. So the answer here, the complement component that acts as an opsonin, is C3b. And then which complement protein aids in neutrophil chemotaxis? That's C5a. Which complement proteins form the membrane attack complex? So you can think of the membrane attack complex kind of like assembling a gun. You have all these different pieces, C5b, C6, C7, C8, and C9, all these different complement components. And they sort of get inserted into the plasma membrane one at a time until there's a big hole in the membrane that disrupts the cell's ability to maintain homeostasis, and the cell dies. Next, a 42-year-old obese man presents with a complaint of severe pain in his right knee. He believes he injured it while dancing at his cousin's wedding last night. You suspect gout. How would you differentiate between gout and pseudogout upon exam of synovial fluid aspirate? So with gout, the joint fluid has monosodium urate crystals, which are needle-shaped crystals, and they're negatively birefringent, so they look yellow under parallel light. Then in pseudogout, these are calcium pyrophosphate crystals, which are rhomboid-shaped, and they're positively birefringent, so they're blue under parallel light, and they look yellow under perpendicular light. That's the end of this question set. I'll see you next time.